to reiterate, you support the Medicare For All bill, I think initially co-sponsored by Senator Bernie Sanders. You're also a co-sponsor on it. I believe it will totally eliminate private insurance. So for people out there who like their insurance, they don't get to keep it?
Well, listen, the idea is that everyone gets access to medical care. And you don't have to go through the process of going through an insurance company, having them give you approval, going through the paperwork, all of the delay that may require. Who of us has not had that situation where you got to wait for approval and the doctor says, well, I don't know if your insurance company is going to cover this? Let's eliminate all of that. Let's move on.
How's everybody doing? My name is Anthony Brian Logan, and today we got to talk about what you just saw, which was presidential hopeful Kamala Harris talking about eliminating private health insurance totally in favor of quote unquote Medicare for all, which ain't nothing but single payer health care. Now, there's a lot to quote unquote unpack here, as the cool kids say. There's a lot I got to say as far as it relates to the social media reaction, people defending her, people that are against her, the whole 9 yards. Now, let's start from the very top. Medicare for all, what is that really? Matter of fact, what is single payer health care? Single payer health care means that you pay the government X amount of dollars for your health insurance. You don't pay private insurance anymore. That's what that means. If you make a certain amount of money below a particular threshold, you probably would get it for free. Single payer healthcare is the conduit, it's the road to universal healthcare, which, if I'm wrong, let me know in the comments below. But that is totally free for everybody, provided by the government. Now, this is bad news, obviously. We see what's going on with the VA, the Veterans Hospital. That's run terribly, and that's all government funded. People are camped outside of the VA in certain states like California and dying there, waiting for a very long time to get treatment. It's not a good system. It needs to be reformed. And we want to do that same thing with all healthcare in the United States for everybody. Even if you can't get treated in the VA, you have the option to go to a civilian hospital, at least with your own money, if that is something you can do. Not all veterans have a lot of money or have the money necessary to be able to go to a regular hospital, but the option is still there. But if you have the total system in the United States controlled by the government, there's no option. This is the road to communism. Communism means one party. So how was it any different than having one healthcare or one health insurance provider? That's not the way to go. Now, some would bring up Canada. Oh, they have single payer and private healthcare. That's true and it's false. They do have single payer and private health insurance, but the private health insurance are for things that don't really cost a lot of money. Vision, dental, that kind of stuff. Things that you don't need health insurance for. Maybe dental, but definitely not vision. You see, I wear glasses. These are not just for fashion. I'm not just trying to be handsome over here. These are actually prescription glasses. I need these to actually see. I've been wearing something like these glasses since I've been 8 years old, and I'm 34. I'll be 35 this year. So you're talking about, a very long time I've been wearing glasses. I don't need vision insurance because I can go to Walmart and get an exam for like $50. So why would I pay any amount of money insurance wise per month to only get a small discount or get a free eye exam? It doesn't make any sense. I'll end up paying more money in insurance than I would just getting an eye exam. And you don't get an eye exam every year, maybe every 3 to 4 years max. So $50 every 3 to 4 years, that's not a lot of money. And when I need glasses, I go to coastal.com or somewhere else and get them for like $100, $75. So, I mean, why do I need vision insurance? Why do I really need dental? You do need, however, medical insurance when you're talking about going to the hospital, having a surgery, getting medication. And that's where the single payer health insurance system kicks in. And you don't want that because we see how the VA is run right now. We can talk about Canada, and that's fine. That's a foreign country. It's close to us, but it's a foreign country. We can just look right here to our own country and see what's going on with that. It's not the way forward. But I will give Kamala Harris credit. At least she's being honest. You have to eliminate private health insurance to have single payer. How are you going to have single payer with other insurance providers. Okay. The only reason why you have other private health insurance providers in Canada is because those insurance providers cover things that the single payer system does not cover. They're not going to cover vision and dental. You could take care of that privately or not pay insurance. That's pretty much how they look at it. Now, the whole concept they're talking about here is single payer will reduce costs because rather than the monies you're paying going to Aetna and Cigna and, Blue Cross, Blue Shield, whatever, it goes straight to the government. And then from that pool of money, it gets spent appropriately. But as I know, or at least you should if you don't, that the government does not spend money appropriately. They waste money. Okay. And what's to prevent the government from price gouging the actual plans to subsidize those that don't make a whole lot of money? At a certain point, it'll become another tax. That's what Obamacare is teetering on the edge of. They probably wanted to have single payer be the backbone of Obamacare because let's not forget, they had the whole penalty thing if you didn't pay. So if you're not paying money to the government for health insurance, you get penalized or you got to pay a fine. It seems like you're required to pay it, which would be the same thing as single payer health insurance in general. Okay. Either you be required to pay the government or you have no health insurance. Maybe since it's the government, they can require you to pay it and then garnish you if you don't. Isn't that what happened with Obamacare? People's tax returns are getting garnished because they didn't pay the health insurance. You see what I'm saying? Okay, you didn't pay health insurance this year at all. So we're going to fine you $3,000, $4,000, whatever, how much money we want to fine you. And we're not going to tell you to actually pay us in the check. We're going to take it from your tax return. You won't even see it. It'll just be gone. That's where we're headed with people like Kamala Harris, Bernie Sanders, anybody on the left that wants to advocate for single payer. So that is pretty much all I got. Do not support this single payer thing. It's not good. Other countries talk about how well it is, but that's not really the case. Canadians have problems with it. That's why they come over here to get treatment. Rarely do you see an American go to Canada for treatment, but it's common the other way around. Why is that? Put two and two together, you can figure it out. So that's pretty much all I got to say. What say you? Do you think that single payer health insurance is a good thing? If so, please explain to me why. Why is that a good thing? Why should I pay the government only and not have options? When you have options, that creates competition, and competition creates better service, better prices, the whole nine. When you don't have competition, you're going to get paid regardless. When there's nobody else out there, you can pretty much do whatever you want. You have the monopoly. And don't we have laws that are against monopolies in the U.S.? I guess so, but maybe we don't in this particular case. Will anything like this ever pass? Or I don't want to say ever. That's kind of a long time. Will it pass at any time in the near future? How do you feel about Kamala Harris, Bernie Sanders, people like that? Whatever your comments are, please let me know in the comments below. And that's all I got to say for this video. If you like what you heard, please comment, rate, share, and subscribe. Peace.